All right, thank you, and good morning, everyone. As mentioned, my name's Jesus Herrera. I'm with BOK Financial. I'm the education consultant. So today we're going to do a broad overview of your 401k, and also at the end, we'll definitely take any questions that you might have. So please feel free, to ask any questions. No such thing as a dumb question. All right, so getting started. When I look at retirement, uh, I'd love to ask the question of what is the number one concern of individuals. And for most individuals, it's about, do I have enough money to live on in my retirement years? And then that raises the next question that I have for individuals, and that is, how many of you have ever calculated how much money you might have based on what you're doing right now? And the majority of people kind of just shake their heads going, nope, haven't done that. So to me, it's a little bit ironic that our number one concern is having enough money for retirement, but yet right now we have absolutely no idea where we're going. And so the other thing that I notice that makes the saving for retirement so frustrating is, one, we have no idea where we're going. So we're kind of just blindly moving along our path. The other part is when we see a down market, people get much more frustrated because of the fact that they're watching their balance and their balance is going down. And they just get that feeling, and I'm never going to get there. The problem is I never knew where I was going. So by taking the time and taking some action to take more control of your retirement planning, and that's not something that we wait till we're, a few years out from retirement. That's really something we do now and as early as possible so that we can then manage our path and hopefully be on track for retirement. So with that said, how many of you ever feel like the hamster in the wheel? Kind of just saving for retirement, no idea where you're going. And so that's one of the things that I always look at is, we all dream about retirement. How many of you woke up this morning thinking about, can I retire? And yet we take very little actions to get us to that goal. So when we look at the, retirement, it's a broad category, it's a broad topic. So what we wanted to do was narrow it down to 4 steps that if individuals take these steps, their ability to be successful in their retirement savings is going to be much greater. And it all starts with participate. Participate in your 401k plan. And not only does that give you the most flexibility in saving for retirement, but it also, and a point that a lot of people miss out on, is that it also a great way to manage your tax bracket, not only today, but also in the future. And I'm going to talk about that in more detail. So in your plan, to be eligible for the plan, just have to be 21 years of age, complete 1 year of service. Once you've completed that eligibility, you can enter the plan on the following January 1st or July 1st. So if you've already met this eligibility and you're past your entry dates, you can start contributing and start participating at any time thereafter. Now, your plan does have an auto enrollment feature, and that is for for new employees that take no action to enroll in the plan. They're automatically going to be enrolled in the plan at 2%. And then from there, their percentage is going to then be increased by 1% until it reaches 7% each year. So each year, you're going to see those small incremental increases to your contribution percentage until it reaches 7%. Now, how much can you contribute? You can contribute up to $23,000 for this year. So that just shows the amount of wiggle room that we have in contributing the amount that we need to save for retirement. Does everybody need to save $23,000 a year to be successful? The answer is definitely not. That's just the limit that we have to be able to contribute what we need. Now, we can also contribute on a pre-tax and/or Roth basis. And the advantage of both is that it does actually give us the ability to control our tax rate while we're saving for retirement. And the reason I say that is when you look at your pre-tax contributions, the advantage of the pre-tax contributions is that it's helping reduce our taxable income today. The the taxes I would have paid on the contribution actually stay in my paycheck. So I'm keeping a little bit more of my paycheck. The other advantage is at the end of the year when I get my W-2, I'm going to notice that what I contributed for the year does not show up as taxable income, which means I'm reducing my taxable income that I'm claiming on my tax return. So pre-tax contributions help me reduce my taxable income today. Now, for the Roth after-tax contribution, the benefit of the Roth contribution is that it helps me reduce my taxable income at retirement. And the way it does that is if I meet the two requirements to benefit from the Roth, and that is hold the money in the account for 5 years. That clock starts ticking from day one that I make a Roth contribution. And the second is I wait till age 59 and a half or older to start withdrawing my Roth contributions. Then all of my earnings that I have made over that period of time are tax-free. So it's helping me to reduce my taxable income at retirement. So lots of theories related to, when you should use one over the other. Keep in mind that as far as how much you're going to accumulate, there's no difference between the two. You're going to accumulate the exact same amount, whether you're doing pre-tax contributions or Roth contributions, because the same amount is being deducted. So it's really more at distribution time where you see the difference. And so, as I mentioned, lots of theories related to when you should do one over the other. For me, that was way too much to think about. And for the majority of my career, I basically took my contribution percentage and just kind of split it between the two. And now, as I'm getting closer to retirement and looking at my planning, it really gives me the ability to control what my tax rate is going to be in my retirement years by the way I use both of these sources in my retirement years. So I actually have control over what my tax rate is going to be. So beyond just saving for retirement, your 401k can also help you greatly control your tax rate, not only today, but also at retirement. So keep in mind that the company does make a discretionary contribution. It's an annual contribution. So basically, once they close the books, they kind of see what the financial situation is, then they determine what that contribution is going to be. In order to qualify for that contribution, you do have to complete 1,000 hours of service. Keep in mind that if you're working a 20-hour week, that's going to accumulate to the 1,000 hours. And then also you have to be employed on the last day of the plan year to receive that year's contribution. So it's an annual contribution. And so just kind of one of those things to look for in your account, probably, early in the second quarter, more than likely. All right, and then your ownership of that contribution is based on a 6-year graded schedule, which simply means that once you've completed 6 years of service with the company, any discretionary contributions that you have received are 100% now yours. If you were to leave before completing 6 years of service, you would take a percentage of that money depending on how many years you have actually completed with the company. The other thing is, keep in mind that the vesting is based on years of service, not years participated in the plan. So let's say you've been with the company for 3 years, you've never participated, but decided to start doing that now, you would already come into the plan 3 years vested. So it's based on years of service, not years participated in the plan. All right, so what's number two? What's step number two? And that is use an age-appropriate allocation. anytime we talk to participants about investing, it's always in the form of an allocation, spread your money around, because not only does that give you the advantage to take advantage of all the different markets out there, but also it actually reduces the risk of investing because you're spreading your risk around through the different markets. And as we know, different stocks operate at, in different ways depending on what the economy is doing and things like that. So it's very important to spread our money around. Now, in your plan, you definitely have the capability that if you want to create your own allocation, you certainly can. You have all the different categories. You have cash equivalent, you have fixed income or bond funds, and then you have all the different types of stock funds, large cap, mid cap, small cap, and international. So you certainly have all the categories necessary to be able to go out and create your own allocation. Now, if that sounds like too much work, you have the BOK Financial target date funds, which are allocations already created for you. And the great thing about the target date funds is once I pick the fund closest to the year I potentially will retire, the fund manager basically then does all the work for you. So to kind of give you an illustration of that, the target date funds follow what we call a glide path. The glide path determines the split between stocks and bonds at any point in time in the life of that fund. They all have the same investments. The only difference is what's the split between stocks and bonds. So as you can see here in the example of the 2070 fund, the 2070 fund starts off with about 95% in stocks and only about 5% in bonds, because the focus of funds like the 2070, the 2060, even the 2050 fund is growth. It's about growing your investments. It's not about protecting. Too many times I see young individuals that, because you see the market going down, they feel like they need to protect. And keep in mind that regardless of whether the market's going up or down, your account is still growing. So it's very important, and that's why we always tell participants, even in a down market, stick with it. You're going to come out ahead as a result of the down market, because what that means is that the shares I'm buying are cheaper, which means I'm buying more shares of these funds, which then when the market comes back up, I actually end up with more money. So to give you the example, the target date fund, in the case of the 2070, goes from about a 95% in stocks and 5% in bonds to roughly about 45% in stocks and 55% in bonds when it reaches its retirement year. So it's the same thing for example, for the 2030 fund, which is roughly about 5 years out from retirement, then you would see that it roughly has about 55% in stocks and about 45% in bonds, making its way down towards its allocation at retirement. So fund manager does all this work for you. Your only decision is which is the one closest to my retirement year. Makes it really simple. Also, we are in a presidential election year, and you can't avoid it, because if you watch any kind of TV, you're going to see the ads, right? So the point we want to make is a lot of individuals do worry about, who the candidate, who may win and who will control Congress, and how is that going to affect the market? Well, as this graph illustrates, that it doesn't matter. The markets don't care which party is in power in the White House or in Congress, because as the chart shows, the market does its own thing. Neither one controls the market. So the stock market, the bond markets, they do their own thing. And for us, it's just a matter, as far as the markets are concerned, there's only one question they want to answer, and that is, what is the result? And then from there, the markets move on. So they don't care which party, and be careful. I've seen too many individuals that get really concerned as to who might win, and they make changes and because they're so concerned with what's going to happen with the market if so and so wins, that they go to potentially cash, they go to a money market fund, and then they lose out on the growth of the market that typically occurs after a presidential election. So be real careful with it. This chart really does show it, that the markets don't care if it's red, blue, they do their own thing. And keep in mind, the markets are at all-time highs as of right now. So something to keep in mind as you go forward. So be careful with that. All right, so calculate your retirement balance. Take that action to actually understand, where am I going? And a lot of individuals, the a big reason they give me for not doing this is because they feel like, I'm not going to have enough. Why do I need to even do this? But again, once I know where I'm going, then okay, let's say that it isn't what I was hoping that it would be. I have the time to make small tweaks to be able to improve that situation, get me closer to my goal. But the other side of that is, and this happens quite often, is once people sit down to calculate, can't tell you how many people I've run across that are shocked that they're going to be better off than they ever thought, just simply because they're doing this, but they've never taken the time to see where they're going. And all of a sudden they find out, wow, I'm actually doing better than I thought. And again, it gives us the ability to just look at it and continue planning instead of trying to wait till I get closer to retirement, when it's really difficult to then make changes that are going to make a difference in our retirement savings. So take the time. In your plan, you have the Retire Right Planner, which is on the website. It's on the mobile app. It's basically the homepage that you see. You have the ability, you can change move your contribution rate, see how much of a difference that's going to make, how much longer is the money going to last. From there, I can look at all the different assumptions and kind of play around with these to see, how has that changed my retirement savings? So I can change and play around with my retirement age, my life expectancy. How many individuals know what your Social Security benefit's going to be? So a couple of things why that's important. First of all, it's understanding what my benefit might be, right? And when I'm doing my calculation, that's going to be a part of my retirement income. So I want to kind of put that in and include it to see where's that going, how's that going to help out. The other part of that is that when you register on the Social Security website, it does show you the all of the salaries that have been reported to the Social Security. And keep in mind, they take the last 35 years to then calculate what your Social Security benefit is supposed to be. So it's really important to make sure that all of that information is being reported correctly. So a lot of really great information here, a lot of numbers that I can kind of play around with to see, what my retirement picture could look like. Okay. So as I mentioned, if we used to get a statement from Social Security about every 10 years. They pretty much have done away with that. And now you just register on the website, ssa.gov and gov. And from there, you can see what your benefits are going to be. They show you what your benefits are going to be starting at age 62 through 70. So they break them out by age. So you can kind of get a feel of, if I wait, what's the benefit, and things like that. So a lot of really great information. Also, it's about, making sure that the salary information that's being reported is correct. So great information available through the Social Security website. Highly recommend register if you haven't already. So what's the last step? And probably the most important step that people really miss out on, and that is roll your balances over every time that you leave a job and start a new one. Unfortunately, the first thought that most individuals have when it comes to their 401k when they quit a job is, oh, I can go pull that money out. And which means that now you're going to go to your new job and you're going to start over. And if you keep starting over again enough times, it's going to be very difficult, no matter how much you contribute, how you invest your money, to accumulate enough money for retirement. And unfortunately, I see this time and time again where people leave a job and go pull their money out and then start over again. And then they get closer to retirement and they're wondering, I've saved for a number of years. Why have I not accumulated more? And that's because I kept starting over again and again. So to give you an example of that, we have Mary, who at age 25 starts to save $4,000 per year. She does it for her entire career. Now, this doesn't mean that Mary stayed with her company for 40 years. She simply, every time that she left a job and started a new one, she always rolled her money over. She had that habit of rolling her money over. When she got to retirement, she ended up with about 992,000. Now, here's the interesting thing when you break down that number. Of that 992,000, only 160,000 is her actual contributions. The 832,000 is her earnings. Individuals look at their balance and feel like that's their contributions, like the majority of that money is their contributions, but within a very short period of time, what actually makes up the biggest part of your balance is earnings. Now, if you were wondering what's the potential benefit of Roth contributions, if Mary had done Roth contributions her entire career, that 832,000 in earnings would be tax-free. So just to kind of give you an essence of what that benefit could be in when you utilize Roth. Again, lots of great benefits by using both and taking advantage of what both have to offer. Now, we've got James who waits till age 35 or starts over at age 35. Maybe he quit a job, took his money out, started over again. And even though he's contributing more, you notice that he ends up with less. And when we break down his balance, you'll also notice that the biggest difference in the balance is related to earnings, because the difference in contributions is pretty minor. It's only $20,000. It's earnings where you see the big difference in their balances. And then as we look at Sarah and Mark, even though they're contributing so much more, you still see that they end up with less, because time is a huge factor in saving for retirement. The earlier you can start and stay with it and rolling your balances over each time, the more successful you are going to be. Now, to log on to the Start Right website, really simple. If you've never registered, so you can see your balance and track your balance, it's really easy. You have the option that you can go on the Start Right website or through the Start Right Retire Right app. Now, we are going to send a copy of the presentation over to Kathleen and to Joy, so I'll send that out to you all, and so you get a copy of so you can go back and review any of this information. And then from there, you're going to enter your Social Security number, your date of birth, click on the button that says I'm not a robot. From there, it's going to allow you to create your own ID, your own password. Make sure you do pay attention that for each one of the criteria, you are getting that little green circle next to it. And then once you've completed that, we're going to send you a code. We use multi-factor authentication to verify who's logging in. Make sure that you do keep a current phone number with Human Resources. If you happen to notice that the wrong phone number is listed for you, please see Human Resources, give them the correct information. They will forward that information to us. For security reasons, we don't allow participants to change their phone number on the website or the mobile app. You have to go through human resources, and then they'll forward that information to us. Now, as as a reminder, you are auto-enrolled if you take no action, but maybe you want to choose something different. Maybe you want to contribute more than just the 2% where you get started. You can enroll. You can go into the system, click on once you're registered, the next screen you're going to see is going to be a big blue button that says Enroll Now. You're going to click on that button. You're going to select if you want to make pre-tax and or Roth contributions or both. Then it's going to then scroll down, and there's actually a section that will allow you to increase your contributions automatically. You can set that up on the system to basically if you don't want that, make sure you click on that opt-out box so it doesn't. But you can bypass that. From there, it's going to have you select your investments. Now, if you're choosing one of the target date funds, in that empty box next to the name of the fund, you're going to enter 100% because whatever you contribute, that's 100% of what you need to invest. So just enter the 100% if you're using one of the target date funds. And then last but not least, make sure you select your beneficiaries. Really important that you do select beneficiaries because if something happens to you, it's really important. We need to know what to do with that money. Keep in mind that when you're selecting your beneficiary, if you're married, your spouse is your primary beneficiary receiving 100%. If you want to leave less than 100% to your spouse, you can do that, but your spouse has to consent to receiving less than 100%. There is a consent form that they have to complete and have their signature notarized. So just be aware related to that. If you're single, you can name anyone you'd like as your beneficiary. No one has to consent to it. Also, last but not least, caution you about naming minors as a beneficiary because until they turn 18, they cannot claim this money. So if you're wanting to leave it to your children and their minors, the better way to do that is through a trust. So it just gives you, that ability to make sure that the money is being used for the benefit of your kids. The other thing is, maybe you've named a beneficiary on your life insurance and you think, well, that'll carry over to my 401k. It does not. Completely different rules related to the beneficiary on your life insurance versus your beneficiary on your 401k. So it's really important that you name a beneficiary on your 401k. You do that on the website or on the mobile app. And so also last, don't forget if you have a life event, you get married, you get divorced, that you make sure you've named the correct beneficiary. You've made that change on the website or the mobile app to ensure that the money goes to the correct person. So to double check your beneficiaries through the website or through the mobile app, on the website, you'll go to Start Right website. On the upper right-hand corner, you'll click on your name. You'll look at profile. You can make changes or add beneficiaries, update your beneficiaries. On the mobile app, you're simply just going to go to the button for beneficiaries. And again, then you can make any changes that you have. All right. Any questions that you have for me? And you have a question, make sure you unmute yourself.
How can we make an appointment to meet with an advisor?
Great question. So what you'll do is contact participant services and they will take down your information and then put you in touch with the financial advisor that's assigned to the plan.
And where do I find that contact information? On the website for participant services?
Yes, or your human resource department also has it.
Okay, thank you.
All righty.
All right, does everybody see my screen? Just to confirm, perfect. Okay, so again, my name is Shannon Younglove. I am with Lovett and Touche MMA, and we are your brokers. So welcome to your 2024 benefits open enrollment meeting. This is your time to do all kinds of fun stuff, and we're just going to kind of jump right into it. So your open enrollment dates are starting from today through the 1st of November. So this is the time to make all of your changes, and changes become effective on December 1st. Let's see. Perfect. So we are going to talk today about open enrollment, changes from last year. We're going to review benefit plans and programs, next steps, questions, and answers. Feel free to shout out anytime you need something answered. If you have a quick question, you can post it in the chat. If it's something that's private, I'll make sure that HR shares my email with you at the end, and you can reach out to me privately. So eligibility and enrollment. Open enrollment, again, I apologize, these dates have not been updated, runs from today through the 1st. This is your time to add, change, or remove dependents. You can enroll, change, or waive coverage. You can add voluntary life insurance. And again, I know you heard about this with the last speaker. This is your time to update your beneficiaries. So since you have to go into the program iSolved anyway to do all of these changes, go ahead and update your beneficiary at that time. This is your only time throughout the year that you can make these changes. So you kind of lock yourself into for the year, you kind of pick your different plans that you want to be a part of, and that's kind of where you're going to stay unless you have a qualifying life event. So a qualifying life event would be something like marriage, divorce, birth or adoption of a child, gain or loss of coverage, loss of dependent status, those kinds of things. There is a very, very, very long list of qualifying life events. So this is just a really brief snapshot. If you feel like you are or have a question about a qualifying life event, go ahead and reach out to HR, or you can reach out to me and we can pull a whole list of qualifying life events. So when one of these things happen, if marriage or divorce, any of these qualifying life events, you need to make sure that you contact HR within 30 days. So let's say right now you're getting ready to have a baby. That baby will be automatically covered under your coverage for the first 30 days. The one day after that, if you haven't enrolled them in coverage, they will no longer be covered. So that's something to make note of. Who is eligible to enroll? So regular full-time employees working at least 30 hours a week are eligible to enroll the first of the month following 60 days of employment. You can also enroll your spouse, domestic partner, children, stepchildren. One of the great things about insurance now is you can have your children on your plan up to age 26. So as expensive for everybody, life insurance, medical insurance, all the different things are so expensive. It's nice to be able to keep our kids on our plans just a little bit longer before they have to look at that expense. Here is your benefit plan review. You can see that your plans are still with Blue Cross Blue Shield. You still have VSP Vision, Equitable for Life, AD&D. You've got your health savings account with Blue Cross Blue Shield, ComPsych for employee assistance, and Legal Shield and ID theft. So we will get into all of these plans specifically as we kind of go through this program. So first off, let's talk about medical plans. I'm going to talk about a little bit what exactly a PPO plan is and what exactly a high deductible plan is. Some people know the differences, some people don't. So bear with me just to be able to explain the differences. Most of us are used to a traditional PPO plan, right? You have a copay, you have a deductible, and you have coinsurance. The great thing about a PPO is you don't have to have a primary care physician. You can see any physician you want in the plan. You can pick any specialist. You don't have to, go see one doctor, go see another doctor. You are in charge of your medical plan, which is great. Always note, you are going to pay much less money if you stay in network than go out of network. A high deductible health plan is similar to a PPO, although it has a much higher deductible, so the premium is much lower. So it's still going to be, you can see any doctor you want. You don't have to have a primary care. You can see any specialist you want, but you also have an HSA account on the side. So you can defer funds from your savings account, from your paycheck into this HSA savings fund, where you can put money away for medical expenses. So just think, if you now have a higher deductible with a lower premium, maybe use that money to defer into your HSA account and then just automatically have it there for expenses. I think there was a question that was brought up. Let me open this really quickly. There are no dumb questions, first of all. Is there any point in keeping them on your insurance? Do they need their own coverage? And say that. So if your child is under 26 with Blue Cross Blue Shield, this is a really broad network. If they're out of state, then you can absolutely still keep them on your insurance. It's really going to be a cost to, look at that cost for you and look at how it works. Where are they going if they are getting off your insurance? Is it because they have a job somewhere? But if they're in college out of state, they can absolutely stay on your insurance. It's more cost effective than you think. So, but that's a really, really good question. So thank you. Okay, we're going to look, you guys have 4 plans. Your team and our team got together and really kind of looked at what was cost effective for its employees and staff moving forward. The cost of insurance just in reality has gone up by about 30% this year overall. So our teams had to meet and kind of say, okay, where are we going to save money at? These plans, what's the best plan? What does that look like for the employees? And one of the things that we just didn't really benefited you anymore was the $3,000 plan. It was just too expensive. It was too cumbersome, and it just wasn't a good deal for the employees of this company. And so we just wanted to kind of take that plan away and bring in a couple of options that we felt like were just less expensive and more beneficial. So you can see that you've got the PPO 6000 Alliance and the 5000 statewide or Alliance. Those are both PPO 6000 and 5000. And then you have the HSA 6000 and the HSA 4000. So one thing to note is the Alliance network is a little bit narrower than the statewide network. So your statewide network is kind of out here, and you get to pick your doctors, your hospital, where you want to go. And then you're going to come in a little bit to the Alliance network. And we're not talking like a super skinny network. We're just talking something that's a little bit more lean. When you're looking at all of these different plans, this is sort of your time where you have to kind of step back. You have to look at what's happening in your life, and you have to look at your budget. Are you older? Are you younger? Are you mid-age? Are you single? Are you married? How old are your children? Do you have young children, middle schoolers, ones that are going to be growing up and going away soon? What does that look like for your budget moving forward? I think one of the scariest things when people are looking at moving from a PPO to an HSA is this, calendar year deductible that they have to meet, right? They're going, okay, I have to pay out of pocket all the way up to this amount. That seems really, really scary. But the thing is, if you're using the program right and you have the high deductible health plan with the HSA plan, you're already putting money aside to pay for all of these medical visits that you may have. So it's not as scary if you think you're saving for it up front. So you've got a PPO plan where you know what you're going to pay out of pocket. You're going to pay whatever percentage. You're going to have co-insurance. You have to meet a deductible. One of the tough things about PPO insurance is even though it's nice that you can map it out, people think that every dollar they spend goes toward their deductible. And it is just not the case. A percentage of dollars that you spend on particular things, which is up to each insurance company, goes towards that deductible. For the high deductible health plan, every single dime you spend goes straight towards your deductible. So you never have to worry like what percentage is going, what does that look like? It's dollar for dollar. Everything is going straight to that high deductible health plan, individual deductible. Any questions before I move to the next slide? This is a lot of information. So if I need to stop and go back, I'm completely happy to do that. Okay, I think we're good. So how to find a provider, it's going to be just like last year. So you're going to go to azblue.com, find a doctor. You can look up doctors by their address if you can't remember their name, but you're just like, oh, I think they were on this drive, or their specialty, or, any myriad of ways you can look them up by your zip code. So always, again, stay in network. You're going to always pay less money if you stay in network than if you go out of network. Telehealth services. I don't know how many of you use telehealth services. I've been speaking quite a bit, the last few years, but I've been speaking consistently for the last 3 or 4 weeks during open enrollment periods. And I can't tell you how many people don't really know how telehealth works. If I wake up tomorrow morning and I don't feel good, I don't want to get dressed and go to the doctor. I want to, go online and talk to a physician and not have to leave my house except for maybe to drive through and pick up my prescription. That's how telehealth works. My children are older, but I wish we had this when they were smaller. They wake up, they have a sniffles, their ear hurts. I've got to get to the office. Am I going to take a half a day to get in to take them to their doctor, or am I going to use telehealth because it's a simple doctor visit? Definitely not telling you not to go to an in-person visit or urgent care or anything like that. But if you don't have to go and it's an easy visit, use telehealth because it literally is zero cost to you. So if you have a PPO plan, you are going to pay zero cost to use telehealth. If you have an HSA high deductible health plan, starting January 1st, you will pay a $5 copay. But that's it. $5, stay in the comfort of your own home, stay in your jammies, keep your kids home, and use telehealth. You also have Blue Shield of AZ online or on the go. So this is an app that you can download on your phone. You can also find doctors here. You can track your claims. You can track payments. You can review drug coverages. And this is obviously 24/7 because it's an app. So if you have this insurance, you should obviously just already have the app on your phone. It's just a lot easier than trying to, guess what claims have been paid, what claims haven't been paid. Just go to one place and you can see everything. Okay, GoodRx. This was another question we threw out in the last couple of weeks, especially yesterday. And, said, how many people know what GoodRx is? Does anybody use GoodRx? GoodRx is simply an app that you download on your phone that helps you find the most cost-effective place to pick up your prescriptions. We had somebody yesterday, and I can't remember exactly what the amount was, but it was somewhere around $60 a month. Her insurance was the payment for her medication. And she ended up paying, a third of that going through GoodRx. I had an appointment with someone last week who was also in the $67-ish range and ended up paying something like $7 a month because they put the information from their prescription into the GoodRx app, put their zip code, they got their prescription for so much less money. So why would you pay more for your prescription than you had to? It's not going out of network. It's not causing a problem with your insurance. All it's doing is saving money for you, putting it back in your pocket. I was really bad the last time I picked up my medication and I used my savings to go get a cup of coffee at Starbucks. But that was just me. I could have saved it in another way, but it is a nice option to have to be able to save some money. Okay, super important slide, kind of wordy, I understand, but I'm going to break it down for you. Lots of information that would really be helpful moving forward. First thing is understand your coverage. This is confusing. I understand. You've got PPO plans, high deductible health plans, you have the HSA. I don't really understand. That's what we're trying to do here is educate you on the different plans. Obviously, please reach out to me after this meeting if you have any more questions or need help understanding and choosing a plan. Know your budget. This is your time. What does it look like the last couple of years? With the salary that I've had, have I had a lot of illnesses? Has everyone been really healthy? Am I looking to have children in the coming year? Am I going to have children drop off the plan? What can I afford out of pocket? Find your local in-network urgent care. So important. I mentioned yesterday, I have an iPhone, and in my iPhone, you can have little folders, and I have a medical folder. And so what I did was I found my local in-network urgent care near my house, and I took a little snapshot. So I know now where to go right by my house, but if I'm not by my house and I have to go to urgent care, I don't now have to go log in to my app for Blue Cross. I don't have to look. All I have to do is open it up and look at the name and then just find the closest one to me. So that's really nice. Just always know where that is. We would never tell you not to go to the emergency room, but there's so many things that you can do at urgent care prior to having to go to the emergency room. So it's sort of first is telehealth, second is your doctor visit, third is urgent care, and fourth is going into the hospital. So that's kind of how you look at, what the severity of the issue is. Take advantage of preventative care. Preventative care is going to keep you healthy. Preventative care is free to you, whether you have the PPO plan or the high deductible health plan. These preventative doctor visits are absolutely free. The one thing I will always say, and again, this is something that I keep in my file, I call it stay in your lane. If you're going to go for your well care visit, you are just there for your well care visit. The second you start talking about something else, something diagnostic, it changes your payment from $0 for a well care to whatever the cost is for a diagnostic visit. So oftentimes we're like, okay, we finally got an appointment. I have so many things I want to talk to the doctor about. Just leave your well care as your well care. All of your mammograms, colonoscopies, as you get older and you're in that age range as well, where they're recommended, those will be covered at 100% as well. I have in my file on my phone 5 questions, and they can change throughout the years. Sometimes I don't change them. Sometimes some things have more importance. And when I go to my well care checkup, I only ask those 5 questions because that's what's primary for me to know during that time. And it could be more or less questions, but it helps me to stay in my lane and not flip my appointment over to a diagnostic visit. So something of note. Shop around for care. Sometimes the doctor is going to send you out and they're going to say you need this blood work or you need this x-ray or you need this MRI. And the first thing you want to do is confirm that that place is covered under your in-network provider. Secondly, that's not the only place you can go. It'll take maybe 10 or 15 minutes to call around a little bit and say, is there a less expensive place for me to go where I can save money out of pocket? That's just us being, like it says, a healthy consumer. We want to make sure we're keeping more money in our pocket and less money going out to someone else. Opt for generic prescriptions. When you have your visits with your doctor, always ask for generic brands. These are just the same brands of medication. They're just listed under a different name. So there's no changing of the core medication. When you go to pick up your prescription, confirm that that is a generic prescription, and always, always, always use the GutRx app. Literally will save you the most money. Review your bills. Okay, we get these little white pieces of paper with all this black lettering on it, and then there's these codes, and it said this got paid, that got paid at this percentage, or this one's still pending. And we're like, I don't even know what this means. Does it mean like they paid it, or I have to pay it, or who's paying it? And we scratch our heads and we're not really sure. You can reach out to the HR department, or you can reach out to me, and we can help you decipher what those bills mean. We can look at summaries of benefits to review if that's a correct cost. Sometimes there's even just, someone accidentally puts in a 3 or a 4 as a code, and it flips it to something that you don't think it was. And you're like, what is this cost? That's not even why I was there. And those are things we can help you with. We also have a client advocate in our office. Her name is Maureen, and she is amazing. If you're having trouble getting something covered, if you have to have a surgery or something like that, or you have a claim that you're having trouble getting paid because you feel like it's been misquoted and quoted in some way, please reach out to me. If I cannot get it done for you, I will absolutely pull her in, and she is extremely tenacious and will do everything she can to get that fixed for you. Lastly, prepare for your appointments, which I think I've kind of already talked about. Stay in your lane, have your questions set ahead of time so you know what you're going to ask, all of those great things. Okay, let's talk about the health savings account that goes with your high deductible health plan. This health savings account belongs to you. You own it. It's your money. It rolls over from year to year. It is not a use it or lose it type of fund. You just get to roll it over. If you choose to separate from the company, this money goes with you. Again, you own it. So you take it with you. You choose how much you want to contribute per paycheck for the year, but you can change that amount anytime you want throughout the year. So let's say you decide to put, I'm just going to pick a random number, $100 per paycheck in. And then you get to February and you're like, wow, this is a tight month. I'm not sure I can really do this. Then you go in and you pull it back down to any number you need to, put it back up or don't. You get to decide. The HSA is always with a high deductible health plan, never with a PPO. So that's always of note as well. So eligibility rules, because the IRS likes to have lots of rules that we have to follow if we're going to do any of these kinds of fun things. So you cannot be enrolled in a non-HDHB plan, just meaning you can't have a PPO with an HSA. Cannot be claimed as a dependent on another's tax returns other than your spouse's, so like your parents or something like that. Not have received any hospital care or medical service from the VA unless you recently be in some kind of active duty situation, then that changes that. And not have an FSA. So you could have a limited purpose FSA, but you can't have a healthcare FSA. So one of the other great things about the HSA plan for Guthrie Mainstream is they give you free money every year to have an HSA plan. They're going to give you $500 and they're going to give that to you over the course of the year. And this is for this year. It could fluctuate for next year, but for this coming year, they're just giving you an extra $500 to help you pay medical bills. That's just a really great gift. So then you're going into the year knowing you're going to have this extra $500 over the year to help pay and offset medical expenses. So that's an amazing contribution. So some of the eligible and ineligible expenses, one of the great things about the HSA is there is an HSA store, and you can see the address for that store on the slide. This has the most comprehensive list of eligible and ineligible expenses when it comes to an HSA. So if you ever have a question, is this okay or not, that's the best place to go. This slide is just a limited view of things that the HSA could pay for. So unreimbursed medical, dental, or vision expenses. If you have the medical plan and then you also have the vision plan, and the vision plan allows you to get contacts or glasses, and you choose contacts, you can use your HSA to now go buy glasses or prescription glasses or any of those other things, which is great. You can use it to pay for your prescriptions, medical supplies. If you have a surgery or something like that and you need crutches or you need, some sort of device to help you after surgery, you can use it for that. Laser surgery, orthodontia. So if you choose to go with the dental plan that we're going to be talking about in a minute, that has orthodontia, it's only going to cover up to a certain amount. And then you're going to max out on orthodontia. But you can use your HSA funds to complete that payment for orthodontia if you want to. Some of the things you can't do: cosmetic surgery, personal trainers, maternity clothes, life insurance premiums, toiletries, can't buy a TV. You have to, just stay within those medical, dental, and vision expenses. All right, here is your dental plan. Again, this is a PPO plan, so you don't have to choose a primary dentist. You can see anybody you want to see in the plan. If you then need to see a periodontist or an endodontist for something, you don't need to go and check in before you go to see that person. Just make sure they're in the plan. So you can see you've got your dental PPO and your dental prime. The main difference between these two plans is going to be one has orthodontia and one does not. This orthodontia is only for children up to 19. You can see the lifetime max for this policy is $1,000. So this is a really great thing if you have those HSA funds set aside. Braces are going to be more than $1,000. So this is going to take the edge off, but the HSA funds will help you pay for the rest. Vision. Talked about this a little bit a second ago. You have a great vision plan. I love a 12-12-12 plan. I wear glasses. I like to get new frames every year. I don't want to wear the same thing all the time. And so this is amazing because you can get new frames every single year. If you choose to do that, like I said, you could use this plan to get glasses, HSA to get contacts, or the other way around. You've got VSP Vision, which I love because you can go to Costco, which is actually where I go to get my glasses, VisionWorks, iMasters. There's just, so many different places that you can go. Okay, basic term life and AD&D. Guthrie Mainstream offers its employees who are enrolled in their medical plan $25,000 of employer-paid life insurance. So you have to be enrolled in the medical plan to receive this benefit. Again, when you go into iSolved for this plan year, make sure you update your beneficiaries. We're going to talk a little bit more about beneficiaries on another slide, but this is just another reminder to update your beneficiaries. You can also purchase voluntary life and AD&D. So as you can see, you can purchase in increments of $10,000 up to $300,000. You can purchase for your spouse and you can purchase for your child. But if you can't purchase for your spouse or your child unless yourself is covered. So that is, make a note of that as well, please. Okay. The Employee Assistance Program. I really love an Employee Assistance Program. Sounds silly to get excited about something like this, but I know it's been really, let's see, someone's waiting in the lobby. Will admit them? Okay. I just have used the EAP program on my own from my own company, and I know my kids have used it as well. So I just really, really love a good Employee Assistance Program. With this program, you can meet with somebody for 3 face-to-face consultations per issue per year. So it sounds limited, but it's really unlimited. You can talk about childcare, family, legal, alcohol abuse, grief, loss, all of these topics. But here's the really great part. We keep talking about beneficiaries. And I know during our last conversation, we were talking about funds not being able to go directly to children under the age of 18, right? You can't leave money, whether it's a life insurance policy or anything else, 401k proceeds, to somebody under age of 18. If you have them listed as your beneficiary, the court's going to step in. They're going to assign someone to now dictate how that money goes to that child. And they won't have full control until they're 18, unless you have a will and a trust. So that is going to enable you to dictate who you want that money to go to then process it to give it to the child, whether that's your own mother, whether that's your sister, whether that's your best friend. You get to name the person in charge of the money. And you can do that through this EAP program without charge. They're going to tell you where you need to go, how you need to do it, what needs to happen. And all of those questions get answered. And you can do that over 3 separate, phone calls. And then a couple weeks go by and you're like, oh, I just had the worst fight with my son. I don't know how to handle this. You can call in again and you can talk about that and see how that works. I know somebody else recently, they just took care of their elderly parent and were just like, I don't really know what to do. I don't know where to go. And they called in and were given all of these resources to help them learn how to take care of their aging parent. This is free to you. Guthrie Mainstream does not track this. The only thing that they get is how many people called in. They get no names, no phone numbers, no address, no identifying information at all. The only thing we want to know is if you guys are using this. I think it's a really underutilized program because life is hard right now. And there are a lot of unanswered questions for all of us as we go throughout the day. So to have this kind of in your back pocket is just really amazing. It gives you that support that you need that you may not want to ask, your neighbor or your coworker. It's private. All right, voluntary coverages. So these are voluntary, which means you pay for them coverages. You have legal services and ID theft. So this is an additional coverage to the EAP, where the EAP they are already giving you for free. And by the way, it's not just you as the employee for the EAP that can use it. It's anyone that lives in your household. So just let me go back to that real quick. Anyone that lives in your household can use that. So here's voluntary legal and ID theft. It's like it says, this legal service covers will prep, trust, power of attorney, real estate, all different kinds. And then ID theft. They're going to monitor your credit to make sure that no one's trying to steal your ID or spend your money without your knowledge. So that's always actually a good thing to have. And then you're going to see a list of all the costs of your coverage. So again, does this include special needs trust? Yes, it includes any kind of trust. Absolutely. Here's a list of all the costs for your different levels of coverage. You go in, you need to budget, you need to look at what you can afford, how old are your kids. My kind of rule of thumb, and everybody can look at it differently. When I had younger kids, we're always going to the doctor, right? It's like just doctor visit after doctor. I feel like that's all I did. I spent half my life in the pediatrician's office when my kids were younger. As my kids got older, they weren't going to the doctor as much. I'm lucky if I can get my adult child to go to his well visit, and he's in med school. And I'm still like, did you do your well check? It's time for your well check. And he's like, ugh, so as they get older, they don't really want to go. And so what can you afford, right? It might be better for you to have a PPO when your kids are younger, because you're going to the doctor all the time and you want to know exactly what it's going to cost you. But if you have older kids or you're a relatively healthy person, there's no reason why you wouldn't want to save the cost on the premium, keep your premium out-of-pocket dollars lower, put that money in the HSA account for a rainy day, and not have to worry about such a high premium. When you're looking at the dental plan, your defining factor is going to be, do you need child ortho care or don't you? That's your question. If you need child ortho care, go with one plan. If you don't, you want to go with the other plan. Makes it super, super easy. The vision plan is very inexpensive. And again, if you can use that along with your HSA account, I mean, you kind of come out ahead in that case. Okay, next steps and reminders. So this is your time, guys. I know we've kind of gotten through a lot of information in a small amount of time. This is your time to make your changes, add, remove, all that good stuff. You have to log into iSolved, just like you did last year, and make any changes, make any updates, look at your beneficiaries, all of the good stuff we've talked about, on and on and on. And I am happy to answer any questions that anybody else has.